This time we are expecting disruption on a far greater scale to planned care, but also a real hike in the threat to patient safety in our key services like emergency care.
What do you make of the standoff between the BMA and the government, and the fact that this is even happening?
Well, trust leaders do understand why junior doctors have reached the difficult decision to go on strike. They, like other staff groups in the NHS, have faced below inflation pay increases for some years, but they are incredibly worried about the scale of disruption which we're likely to see unfolding this week in the NHS. And that's in part because junior doctors are such a skilled and critical part of NHS teams, but it's also because the timing and the duration of this strike are particularly problematic. So coming off the long bank holiday weekend, which is traditionally quite a busy time for the NHS, and then lasting, as you've just described, for essentially this working week until the early hours of Saturday. So we saw about 175,000 checks and appointments rescheduled in the last junior doctor strike, which lasted for 3 days. This time we are expecting disruption on a far greater scale to planned care, but also a real hike in the threat to patient safety in our key services like emergency care.
And also in terms of the impact, and I guess what gives this strike a different flavour to ones that we've had previously when, say, Royal College of Nursing nurses went on strike or ambulance workers went on strike in parts of the country, is that there aren't any services that are protected in this. So even people that might be expecting cancer treatment this week might have that pushed back directly because of this strike action.
That's right. That is a key difference and a step change in the approach and in the escalation of this industrial action that we're seeing. So importantly, the unions have agreed that they will pull doctors off the picket line if there's a serious incident or if extra capacity is needed for emergency care. But that's no substitution to a well-oiled, well-running, well-managed health service. And as you rightly say, this time cancer care is not protected in quite the same way as it was previously. And we have heard some trusts saying that they fear that they're going to have to stand down some cancer activity as well as planned operations like hip operations, knee operations, and so on. And in addition to all of that, they're worried that they'll be incredibly stretched in providing those emergency services which have to keep operating. So that's in A&E, critical care services, maternity services, neonatal care, for example. So those are the services that will be prioritised, and trusts have been redeploying all of their resources towards those services. But they're telling us that the risk to patient safety in those services also is increased this time.
And in terms of trying to ease the pressure on those emergency services and what all of us can be doing, we've got this warning this morning that the public should avoid, quote, risky behaviour. But there was definitely concern the last time that we had strikes that patients didn't necessarily heed that and stay away from emergency services if they didn't genuinely need them. Are you worried that that will happen again, and that just there'll be the same workload despite all of this work that has been tried to do to sort of tell the public that they don't necessarily need to go to A&E in all instances?
Well, we certainly want the public to be aware that this strike is unfolding and that it will place real pressure on NHS services. But the message is the same. If you face a life-threatening emergency, please come forward. Please dial 999 as you would normally do. If you have a planned appointment with the NHS, whether that's in primary care or in a hospital or mental health setting, and you haven't been told it's been rescheduled, please turn up as planned and people will see you as planned. But if you are facing a less urgent medical condition, then please use services wisely. Consider routes like 111 online. And we should add, our message for government and unions is to get round the table and start talking. We'd really hope to avert this industrial action. It looks like this week's strike will go ahead as planned. But please, government and unions, get round the table and avert further strikes like this.
And just finally, on that point, do you think that actually it will help things if ACAS get involved? There have been some calls for that this morning.
It's always helpful to have a third party, someone who's objective, to help facilitate a conversation. So that could be one way forward. I think we need all parties in this dispute to be open to negotiation and open to compromise, and just to start talking, to put strikes on pause.